All right, hey, it's Mr. Peterson back with a quick tour of the external anatomy of the pig. So the first thing you're going to do is take your little guy. How do you know if it's a guy or a girl? We'll figure that out in a little while. And we're going to measure it. You're going to measure it from the tip of the nose, tip of its snout to the base of its tail. So here's the base of its tail. So I'm going to take my ruler, kind of run it around there. So this guy is about 28, we're going to say 28, 28 centimeters. So this guy is between, if you look on your sheet of paper, on your gold sheet, he's anywhere between 100 days, he's over 100 days old for sure. So pretty close to being born, all right? So if we take a quick tour of the external anatomy, first of all, let's talk about like anatomical positions. So the superior end of the pig and the inferior end of the pig are a little bit different than you and I, right? More likely we call this cranial. Why cranial? Because we've got the cranium, we've got the skull right here, and the caudal end, and caudal means tail. Right, so you've got superior and inferior, cranial and caudal, and those are pretty much the same. Okay, then we have anterior and posterior, which are also pretty close to the same. They're a little bit different for people. We have dorsal, so the back, and the ventral, which is the underside, so like the belly of this guy, so ventral. Then we have a term called medial, so that's toward the midline, and lateral, which means away from the midline. So those two terms are used to compare one spot to the other. So if we go out here, here's this pig's toes, its digits. The digits are lateral to its wrist. Lateral to its wrist. By the same token, this is medial to its wrist. Okay? So we can also talk about proximal and distal. So proximal means close to the midline. Distal, hear the word distance in there, so distal from the midline. Superficial means on the surface. Deep, so if we get deeper in there, like it's going to be deeper in there. This happens to be an incision where they embalmed the pig. Now it's blue. It's blue because they inserted latex rubber in there. Okay, so let's continue on quickly here with the tour. So what's this? This is called the ear. It's also known as the pinnae. Here's the eye for the pig. Now, one of the things you're going to look for is the nictitating membrane, and that's right inside the eye. So if we open up the eye a little bit, let's get this guy in the middle so you can see that pretty clearly. So the nictitating membrane, if I open up this eye, come on, there's a little membrane right there. You see that? So I took my blunt probe and I went underneath it. I'm not gouging his eye out, but that's what I'm doing. And then we have an umbilical cord. You and I had an umbilical cord. This guy's umbilical cord is not in that great a shape. So I'm actually going to cut this a little bit close to the pig. Any material that you have left over, set to the side, and eventually you're going to get rid of it. This is maybe not the best one here, but there are 3 blood vessels in there. You can't see them very well on this one. I'll show you in a different pig in just a second. So this is the umbilical vein, and then next to it there are 2 little arteries. You can't see those really well right there, but that's where they're at. You can see that it has these teats or mammary papillae, right? So if this is a female and it's not, those would turn into mammary glands and it would feed the hog. So what is this guy, male or female? So back here he has a scrotal swelling, so he's a scrotum. This is a male, and then right here there's a little opening. That's the urogenital opening. So that's where urine and semen are going to come out. So this is a male. So how do you tell those apart? Well, I look under here and I look for the scrotal swelling, okay? And that's ventral to the anus. So the anus is right there. Both male and female pigs have an anus, okay? So this is the scrotal swelling. This is some extra skin. We'll just get rid of that, okay? Let's look at a female pig. So this is someone's female pig. their umbilical cord has been cut, not really all that great either. But let's look at how you can tell. So, ventral to the tail, the pig has this is called the urogenital papillae, this little bump, this little thing that sticks out. And there's the urogenital opening for the female. So this is a female pig. It has mammary papillae, just like the male does. So a quick tour of the external anatomy.